Reproductive health does not only start and end with women. Men too should pay attention to their reproductive health status. This is a message that a Bloemfontein-based midwife and assistant manager for obstetrics and gynecology services at the university's hospital has emphasized. She says often reproductive ailments are left until too late because people don't want to talk about them, and the primary health care system is also not placing special focus on education. She cautioned that mothers should pay attention to their children to avoid unfavorable circumstances where they have seen teenagers lose their uterus over conditions that could have been avoided.
We as a teacher hospital encounter this woman or get in contact with this woman at a later stage whereby most of the time things have complicated. Whereas it's things that could have been picked up at the lower level, maybe at primary health level, whereby proper health education should have been given to these women. So we are now strengthening on taking back the message back to the clinics to health educate these women, to take the message to our community teachers, whereby we make them aware of health issues that affect both women and male child. We shouldn't exclude the males, because some of the things you find that maybe it's not easy for this man to get the woman pregnant, not because it has started at later stage. It has started way back at childhood.
She emphasizes that parents should be empowered to educate their girl and boy children on reproductive health.
So we are now strengthening on taking back the message back to the clinics to health educate these women, to take the message to our community teachers, whereby we make them aware of health issues that affect both women and male child. We shouldn't exclude the males, because some of the things you find that maybe it's not easy for this man to get the woman pregnant, not because it has started at later stage. It has started way back at childhood.
A reproductive specialist says obesity and smoking are among the biggest hinders of fertility. Lifestyle plays a pivotal role in ensuring that couples are able to reproduce.
As far as obesity is concerned, I always like it because it's a partnership between the doctor and the patient. Because, if we can motivate our patients to reduce weight, to, improve the lifestyle, then, we're able to achieve our objectives for fertility without too much, high-intensity type of fertility treatments. We can use a low-resource type of fertility, and sometimes they're even able to achieve a natural fertility if they are able to bring their weight within the correct control.
The Department of Health in the Free State says it runs outreach programs that ensure that rural communities access information and receive education on reproductive health, which is also part of the global agenda. The department says it is critical to empower women in rural areas because that is where the topic of reproductive health is often not mentioned.
So as a department, we're implementing various programs to ensure that there is improved access in every area in our communities. Now we have women who are staying in rural communities who do not have access to healthcare facilities. In that case, the department is implementing outreach services to ensure that we provide women with family planning services that is part of the sexual reproductive health. We provide them with cervical cancer screening because we have noted as a department that it's the second killer in women amongst the related cancers.
Mangwejani says it is difficult for women to visit healthcare facilities when they are not economically empowered. She says the trend in rural communities is that women rely on their spouses for financial assistance or social grants. Kamogelo Siekwi, SABC News, Bloemfontein.